Hello, everyone. Good afternoon. Thank you so much for your patience. Welcome to ACL's Extreme Winter Weather webinar. This webinar will focus on the significant impacts of extreme winter weather on older adults and people with disabilities, and the need for inclusive preparedness, response, and recovery measures. Our ASL interpreters are pinned, and we are currently working on some technical issues with CART, so please be patient. You can enable captions below, and you can enable ASL by selecting the interpretation prompt and select sign language. Throughout today's presentation, we will be taking questions which will be addressed at the end of the session or in a follow-up email if we do not get time in the session. Please use the Q&A option as chat has been disabled for this event. Your questions will be added to a repository that we've been keeping track of across all of our weather and climate-related webinars this year. Questions from the webinar series will become a resource as part of the series archive. We plan to release the questions and recordings of all webinars in the near future. Again, thank you for being here. My name is Casey Knopp, and I am a Management and Program Analyst in the immediate office of the Administrator at the Administration for Community Living, or ACL. I'm a Caucasian woman with brown-red hair and black glasses wearing a black top, and my pronouns are she, her. I will be moderating today's webinar. During today's webinar, we're going to focus on the impacts of extreme winter weather. Deputy Administrator and Chief of Staff at ACL, Rick Nichols, will provide opening remarks, followed by discussions from our panelists from Alaska, South Dakota, New York, West Virginia, and Maine. Following presentations, panelists will be open for questions from the audience. First, allow me to introduce Rick Nichols, who serves as Deputy Administrator and Chief of Staff for ACL. In this capacity, he serves as a senior advisor to the administrator and principal deputy administrator on policy, program, and operational priorities, ensuring the agency's efforts advance the mission of ACL and HHS. He also provides executive leadership in a number of areas, including disaster preparedness, response, and recovery. Prior to this role, he served in a number of policy and program roles within HHS, and prior to HHS was a policymaker, program manager, and caseworker in the public and private sectors of healthcare and long-term services and supports.
Thank you. As Casey shared, I am Rick Nichols, Deputy Administrator and Chief of Staff with ACL. I am a Caucasian male with dark brown hair and a beard that are both graying. I'm wearing a white shirt, an orange tie, and a navy blue suit jacket. And there is a blue background behind me with an ACL logo. Across the United States, we face extreme temperature days on a fairly frequent basis. 2024 is expected to be the hottest year the world has experienced on record. This last summer in the United States, we experienced our fourth hottest summer on record. While 2024 will not be the coldest year on record, in January 2024, there were thousands of cold temperature records broken across the United States when an Arctic air mass brought bitter cold and snow to much of the nation. And now many communities across the nation are already starting to experience winter weather again. Currently in the United States, there are more than 78 million older adults over the age of 60 and more than 61 million people with a disability. At ACL, we administer disability and aging programs, fund networks of community-based organizations that serve people with disabilities, older adults, their families, and caregivers. We also provide technical assistance and training to our grantees and other partners to raise awareness of programs, resources across agencies and organizations at the national, state, and local levels, and in tribal nations, all to address the needs of older adults, people with disabilities, their families, and caregivers. This, of course, includes the needs related to the impact of extreme winter weather like we're discussing today. We want to express our huge thanks to the many aging and disability organizations in our grantee networks that are doing exceptional work to address the extreme winter weather and related needs of our populations. We also want to thank direct care workers, unpaid caregivers for the critical support that you all provide in advance of and during periods of extreme winter weather. ACL statutory authorities and our unique position within the executive branch of the federal government give us an opportunity to represent and advocate for older adults and people with disabilities and ensure their needs and direct involvement are considered in policies, programs, and research. We're pleased with the progress that is being made to include the voices of people with disabilities and older adults in the development of systems of safety and in preparedness and response efforts being tailored to their needs. One recent example of this is that this last Monday, there was a $98.4 billion supplemental emergency discretionary appropriation request that was made by the Biden administration to the Congress. This request focused on funding options to rebuild communities impacted by recent hurricanes and other natural disasters this last year. Within the request is $159 million for aging and disability service programs. This funding, if passed by the Congress, would be used by aging and disability organizations to provide critical services and supports needed by individuals with disabilities and older adults.
So connected.
The funding could also be used to rebuild and replace damaged physical infrastructure. At ACL, we're committed to continue to advocate and partner across the federal government and with other organizations at the national, state, and local levels on behalf of our populations to ensure that their needs are accounted for in disaster preparedness, response, and recovery policies and programs. We also want to acknowledge, along with all of you, that we have a long way to go in better planning for and responding to disasters and emergencies for our populations. We're hopeful that today's webinar will include helpful examples across the 5 different states, and that this will help us nationwide this year to better plan and prepare for the extreme winter weather events that we could have. And that very well could also mean the difference between health, severe illness, and even death for so many around the nation. I'll now hand it back to Casey to introduce our esteemed panelists for today.
Okay, so today we are going to have Daryl Schaefer from Alaska. He is a PhD candidate in the Natural Resources and Sustainability Program at the University of Alaska Fairbanks, studying disaster impacts on vulnerable populations. Originally from Minnesota, he spent nearly 31 years in the U.S. Coast Guard in units across the country and previously received a master's degree in human resource management and security and disaster management. Then we will have Paige Hudson from South Dakota. He has been with Dakota Link since January 2001, bringing a background in psychology and business studies, along with experience as a technical manager. He coordinates federal project activities with state agencies and programs supporting individuals with disabilities who benefit from assistive technology. Additionally, Paige provides training and information on assistive technology and Dakota Link services to individuals, organizations, and public agencies. Then we will have Joy Baresi-Saucier, RN, MHA, FACHE, who is Executive Director of the Aroostook Agency on Aging in Maine, leading efforts to improve the quality of life for older adults in northern Maine. With over 25 years of experience in healthcare, including patient care, community education, fundraising, and executive leadership, she is a fellow of the American College of Healthcare Executives. Joy is committed to supporting Mainers in aging with their chosen communities. Then we will have Tina Hodeling, based near Albany, New York, who serves as the Emergency Management Coordinator for the New York State Office for the Aging, coordinating disaster planning, response, and recovery with state agencies. With over 30 years of experience in long-term community supports and services, she has managed residential programs and overseen supported employment for individuals with intellectual and developmental disabilities. And finally, we will close out with Dr. Donald Reed, who lives in McDowell County, West Virginia. He is currently the executive director of the McDowell County Commission on Aging, Inc., and an assistant professor at Liberty University School of Health Sciences. Donald has worked in public health for the last 22 years with the aging population for the last 7 years. So I will go ahead and turn it over to Daryl.
Hey, thank you very much for the introduction and the opportunity to speak here. I'm a light-skinned male with brown hair and graying highlights, and I'm wearing a gray polo shirt. Cold weather is relative to where one lives. Alaska is no different, with extremes from sea level to Denali at over 20,000 feet and temperatures from 100 above to 80 below zero. Thompson Pass receives over 500 inches or 41.5 feet of snow. On December 21st, Ketchikan has 7 hours of sunlight, and Utqiagvik is in the middle of 2 months of darkness. Our high temperature in Fairbanks yesterday was -2 with a low of -29. Next slide. Alaska is big, about 1/5 the size of the lower 48 states, equal in distance from Jacksonville, Florida to San Francisco, California, and from the northernmost point of Minnesota to Oklahoma. From an emergency management view of this expanse, cold can be deadly for anyone in Alaska, but especially how far away you are from help. Most people are familiar with the terms urban, meaning in a populated city, and rural, not in a city. In lieu of this in or out population-based measure, a more functional scale would be the average time for initial emergency response to arrive on scene. In urban environments, response is under 10 minutes. That is the current actual standard for fire departments to respond to a major incident. Rural is under an hour for initial responders to arrive. Remote, or maybe you know it as frontier or backwoods, is beyond rural. There might be a dirt road or trail, so initial response can gain access within 24 hours. But geographically isolated is even further away, with a physical barrier like a mountain range or an ocean in between. There is no road access, and initial response is beyond 24 hours, even sometimes measured in days. Why is this important? Studies have shown vulnerable populations are affected by disasters more than other people. A 2023 FEMA publication stated geographically isolated are considered vulnerable population, along with individuals with disabilities, elderly, indigenous populations, and other historically marginalized people. So the further away from a response resource you are, the more vulnerable you could be. Next slide. This map shows the Alaska road, ferry, and rail systems. All accessible roads are in the interior and south parts of the state. There's a single train line between Fairbanks and Anchorage, and the Alaska ferry system runs only in the southeast and southwest coastal areas. West Coast villages have no transportation aside from seasonal barges or weather-restricted flights 400 to 600 air miles from Fairbanks or Anchorage. So when more than half of the state is remote or geographically isolated, distance from assistance does matter. Here are examples of what can occur annually affecting vulnerable populations in Alaska. Based on point-in-time counts, there is an unhoused population of about 3,200 in Anchorage and between 2,000 and 300 in both Fairbanks and Juneau. With a limited number of shelter beds, most people have become adept at living in -30 and snow, but not all survive. How about a cyclone, but with temperatures below zero, snow instead of rain, and a wind chill of -60? Only 4 weeks ago in Kotzebue, an Alaska West Coast village of 3,000, a storm with over 50-mile-per-hour winds flooded most of the town with 5 feet of water, closing the airport, damaging up to 50 homes with 80 people evacuated. Then temperatures dropped into the single digits. There is no Walmart or Home Depot to quickly pick up some plywood, rolls of insulation, a new freezer, or another snow machine damaged from saltwater intrusion. And external aid had to wait a couple of days for the airport to be cleared before they could come in. And just yesterday, Point Lisburn had 60-mile-per-hour winds, gusting to 92 miles per hour. For nearly 2 weeks after January 24th, 2014, a snow avalanche cut off the only access road into Valdez. The avalanche was approximately 1,000 feet wide across the road, over 2,000 feet long, and up to 100 feet in height, and blocked the river, creating a lake 30 feet deep over the highway. People in Valdez were not in the actual avalanche, but did they have the food supplies for 2 weeks? What if the power, heat, or water was actually out? And the big one for Alaska, temperatures are in the upper 20s, 2 inches of snow on the ground, and a 7.1 earthquake happens, with 170 aftershocks, including 3 over 5.0. This occurred on November 30th, 2018, 10 miles north of Anchorage, and was felt up to 360 miles away. Power, gas, internet, water were disrupted. Roads were buckled. All train, airport, and bus services halted operations, and a number of buildings suffered damage. Looking at these relatively typical Alaskan events from an emergency management risk assessment view, clothing, food, and access are 3 areas where vulnerable populations can simultaneously prepare for the daily cold of winter and mitigate the occasional disaster in Alaska. Next slide. Layers of clothing is important when it is cold. Think wicking, warmth, weather. Wear a wicking material close to your skin, then a warm layer or layers over that, and an outside shell to protect from the weather and wind. Indigenous people of Alaska have been layering with natural and even waterproof material, seal intestines, for thousands of years before Thinsulate, North Face, or Gore-Tex. Tight clothing is not always best, as it may constrict your body's blood flow, the main source for getting heat to your extremities, which get cold first and are most prone to frostbite. Use layers of socks with winter boots insulated on all sides, including the bottom. Ice cleats are especially needed when walking on glazed snow. Wear mittens so the fingers can warm each other versus gloves where each finger is isolated and on their own to keep warm. Use a balaclava or neck gaiter over the nose. Keep head and ears covered with different hats when temperatures get below 50, 20, 0, or -30. And do not forget reflective gear. It's cold and dark up here. Food. You will likely not be able to get to the grocery store during a disaster or winter event. And Meals on Wheels, the food bank, Amazon, or DoorDash will not be able to deliver if all the roads are impassable. Keep a supply of ready-to-eat, no cooking needed food and stock up before the storm comes in. Access. This one hits home because we walk a lot. How does your walking cane handle on ice, or do you have an ice grip? Can you find the curb with your white cane if they have not plowed the road, Or maybe they did plow and now there's a 4-foot snow berm at the intersection. Can you push your wheelchair through the snow, and how cold will your fingers get? Does your manual or electric wheelchair have traction? How's your chair's battery life? Battery efficiency decreases in colder weather. How do you clear the sidewalk to get to your car, handy van, or the bus? Can you even reach the crosswalk button at a stoplight? Next slide. These are critical issues many Alaska vulnerable populations face every day in winter, and organizations like SILK, Access Alaska, SAIL, Move United, and other nonprofits are available to help. And a special note, an updated State of Alaska Get Ready toolkit will be coming out soon with tips for various disasters and for specific disabilities. Relying on others helps, but it really comes down to each individual needs to prepare with the right type of gear and adapt to the different weather and hazard conditions. Matsicho, Kuyana, thank you.
Did I just jump in?
Yep, go ahead.
Okay, sorry about that. My name is Paige Hudson, and I'm from South Dakota. I'm the program manager for the assistive technology program for South Dakota. I am a Caucasian male. I'm wearing a New York Yankees hat. I apologize to some people who don't appreciate that. I'm wearing a 3/4 zip sweater, and I have a couple of lights and a fan in the background. I'm not sure if I can share my screen. Can I do that? Let me give it a shot. Can you all see the Dakota Link logo?
Yes.
Yep.
Okay. All right. So I don't really have a PowerPoint, but we do have some procedures that we take into consideration all the time. Whenever we have inclement weather, we obviously have less inclement weather than Alaska, but we do have our fair share since we're pretty much isolated up in the middle of the country. And today actually is our first day of snow for the year, or for the winter. Didn't get much. We're getting a little bit, maybe it'll come up to about an inch, but still. We had, for instance, we had a conference, or we have a conference today out in the middle of the state, which is about 200 miles away. And so we weren't sure if everyone was going to get there. We didn't even know if our employees should go. So we always have to take those things into consideration whenever inclement weather happens, and it happens every year for us in South Dakota for sure. South Dakota is only about 919,318 people in South Dakota. Might be a little bit closer to 1 million by now, but most of the people that live in South Dakota live in the city that I'm in, which is Sioux Falls, South Dakota. It's in the southeast portion of the state, and we have approximately 300,000 people in the city and the surrounding areas here. So most of our activity is in Sioux Falls, but we still have those outlying areas. So we do have to address needs of older adults and people with disabilities during extreme weather. It's crucial for their safety, health, and well-being. We emphasize inclusiveness, preparedness, response, and recovery plans. And we need to account for unique vulnerabilities and challenges that are faced by these populations. Some key areas that we focus on when we think about inclement weather and reaching our clients or them reaching us is the health and medical needs. So some people need health monitoring, and that may be affected by the weather. Older adults and people with disabilities have higher risks for cold-related illnesses like hypothermia and frostbite. And we ensure to make sure that critical medications for chronic conditions such as diabetes, heart disease, respiratory issues, and all of them are available for the clients and individuals so that they can access them during emergencies. There's also obviously power outages for those who rely on medical equipment like oxygen tanks, dialysis machines. It's vital to have backup power supplies or solutions to plan to relocate a person or to have that backup device to make sure that their devices that keep them going are in place. Personal care needs are also a consideration. A lot of older adults and people with disabilities need assistance with their daily activities. We have to make sure caregivers are able to get there or they're prepared with extended periods of isolation or if travel difficulties are there due to the weather. The accessibility is always a concern with weather, transportation, getting there for us to get to them or them to get to us or them to get to appointments are always in consideration. Also, home modifications are in consideration, especially if they're electronically based and connected to their power. And if their power goes out, they may not work. So again, their backup supplies for their medical devices that they may need. And as simple as clearing walkways, put non-slip surfaces in areas where they may fall if it was slippery. Communication is also a consideration. We ensure that weather alerts and emergency communications are available in accessible formats, such as large print for low vision people, audio versions of it, and video with captions. Things that we consider. Some critical resources that we take into consideration when inclement weather happens is shelter and warming centers. We want to make sure that we can identify them and help people to get to them if they need to. If they are not able to shelter in place, then we would want to know where the closest place they can or somebody that can access to bring them to a shelter or a warming center. Food and supplies are very important. Emergency preparedness kits can be provided through local areas or shipped to people. They include enough food, water, medications, and heating supplies that last several days. We also have to consider dietary needs and the preferences of older adults whose disabilities, with disabilities who are in preparing the kits. Social support is also very important. Social isolation is a big deal, especially if you're in a very rural area and people can't get to you for days, maybe weeks is still a possibility with inclement weather in South Dakota. We always have established check-in programs for people during these times so that they can ensure that they have contact with somebody else or somebody knows to contact somebody that doesn't have those capabilities. Especially for those that live alone. This can involve like regular phone calls to them or phone calls when you know there's inclement weather, visits to ensure that they're in a safe environment and they have everything that they need. Training and awareness is the final piece that we always take into consideration for first responders and caregivers. So if somebody needs to go out and be a first responder to somebody in need, we want to make sure that they are trained to recognize the unique needs of older adults and individuals with disabilities during winter emergencies. And that's about all I have for that, unless anybody has any questions. Okay, I think we can move on to Joy then.
Thank you, and good afternoon. I'm just going to share my screen as well. Great. Hi, I'm Joy Baresi-Saucier. I'm Executive Director of the Heuristic Agency on Aging. I'm a Caucasian woman. I have light brown hair and glasses with a blue blazer and a gray turtleneck, and I'm sitting in front of our agency logo. It says Heuristic Agency on Aging. Thanks for having me join you today. Just a few things about the Agency on Aging and Heuristic. We are, forward my slide. I'm from Maine, based in Presque Isle, Maine, which is very northern Maine. I'm showing a map of Maine, and we are the top northeast corner of Maine. We're in a county of our land mass in the county. We call it the county because it's the largest county east of the Mississippi River. It is about 6,800 square miles. We serve the whole county, but the populated portion of the county is about 4,000 square miles. Aroostook County is larger than the states of Rhode Island and Connecticut combined. And listening to our friends here from Alaska and South Dakota share many of the same challenges, although not quite as remote as Alaska. The majority of the region that we serve is frontier and remote, as designated by the USDA. As was said in other presentations earlier, we are in a very remote area of the country. We have about 10 people per square mile in the area that we serve. This picture of a nighttime drive in Aroostook County is a very familiar drive anywhere in Aroostook County, and certainly weather plays a big role in how we think about delivery of service and deliver service as well. Of course, for us in Aroostook County, like a lot of other agencies on aging across the country, everything starts with our information and assistance services. We have folks that call us with all kinds of questions, often about weather-related questions or service-related questions. They often may call related to where they might find a warming shelter, so we can provide that information, as well as link them with other programs and services that may meet their needs related to weather, such as our LIHEAP program or other emergency kind of preparedness resources that we could provide. We work closely with our County Emergency Management Association as well. This picture is one of our volunteers, Betty. She is doing calls. Betty is one of our friendly volunteers, so she makes calls both from office and often from home or visits. Our friendly volunteer program has a visitor caller component to it, where our volunteers regularly connect with a person that may be older and socially isolated. These are frontline volunteers that can often help in terms of extreme weather events to check on people. They regularly have a set time that they interact with their consumer that they're following, but when we get into extreme weather events, we encourage them to make regular contact with the person that they're visiting with. We also sometimes use volunteers as well to make special calls to check on people, such as the individuals that may partake in our Meals on Wheels program. So we can do special wellness checks. In addition, on this slide, I wanted to mention that we often may work or sometimes work with our local law enforcement teams to do wellness checks. If we find that there's someone that we're concerned about because of weather or some other issue, we work in partnership with law enforcement to go do a check check on them in their home. I'd be remiss if we didn't talk about our home delivered meals program and how we deal with that in extreme weather events. This is Brent. He's one of our staff members, and he's packing storm kits in this picture. So all of our home delivered meals participants have a several frozen home delivered meal extra meals that we provide to them annually at least, but as we need them or use them, we will provide them with more, so that if there is a challenge with weather, they will have a few extra meals on hand to help them get through that time. In addition, our home delivered meals volunteers, as they're delivering those meals, will check on people to make sure that they're okay with weather. I didn't mention at the beginning, but we are in an area like some of my peers before me talking about snow and cold. And our average snowfall in Aroostook County is around 94 inches a year, but we can get some rather large storms. In addition, the temperatures can typically are around a low of 0 in January and February, although wind chills drop it below 0 oftentimes, and then several times it's below 0 anyway with additional wind chills. So it can be very cold. We have had situations where our home delivered meals volunteers have actually found people outside in elements, and have called 911 and alerted emergency services to the needs of those folks. So it is the home delivered meals program. I can't emphasize enough the importance of this program and your communities. This is an innovative program that we've been doing in partnership with age-friendly communities in our area, or with the local Rotary Club. So this program is called the Safe Steps program. Our Rotary Club is actually the champion of this program in our community. Rotary works with local businesses to get these 5-gallon buckets. Rotary members fill the buckets, or at least half full. They're quite heavy, with sand and a cup that they can use to spread the sand. And then also usually some information about the agency or where they can get resources. So this is a falls prevention program. The buckets, we take the names at the Agency on Aging. We did about 100 in the town of Presque Isle this just a few weeks ago. We take the names, Rotary gathers the resources and volunteers, and these buckets are distributed to older people in the community so that they can keep them right by their steps, and use that salt and sand as they need it to prevent falls. It's a fantastic program. It's also done in a lot of other places in Maine and often run by age-friendly community initiatives. And lastly, I just wanted to mention our cooperation with emergency management and FEMA. Our big thing that causes us, there's not a lot that causes us problems with extreme weather, I think, because our community members are so used to having extreme weather. But one of the challenges that we have had is related to flooding. A few times in the last 20 years. It doesn't happen every year, thankfully. I know it does happen in a lot of other places, but we have had some pretty good sized towns impacted when the ice goes out in the spring, and we have had flooding. And we've partnered with emergency management locally and with FEMA to get those folks assistance. I think another one of the things about agencies on aging that's great are that we know our local communities. Very northern Maine is French speaking. We have French speaking staff. And so we can help emergency management help others apply for services and programs that respond when these situations occur. We can also help those impacted find resources that they need to carry on with their lives during this period of time. So again, I'm happy to take other questions at the end, or share any information about any of the programs that we provide. I'll stop sharing somehow here.
Thank you so much. We're going to wait and take questions at the end because we have quite a number of presenters today. So go ahead, and Tina, you are up next.
Good afternoon. Do we have the slide? There we go. Is there a way to make that, a whole screen? There's a lot of information shared on here. I want to make sure you have the ability to see it well. There we go. So as we said, my name is Tina Long, and I do work at the New York State Office for Aging in the Division of Local Program Operations. And I spent the majority of my time working on our emergency preparedness program and how it affects older adults across New York State. Go ahead. Next slide, please. Great. So when we think of New York State and winter weather, it is important to be cognizant of its unique and often complex landscape. New York is a very diverse geographic and demographic area. We have very high peaks and valleys. We have the Great Lakes, coastline, as well as very thick forest coverage, all of which both lie within extremely dense or sparsely populated areas. So one of the things here throughout this is that there's no one size fits all when it comes to our readiness and response. The weather in New York can also be very volatile and unpredictable. Weather patterns can range from snow, rain, and sun, often within a 30-minute radius, a 30-mile radius, and 15-minute span of time. New York State has encountered paralyzing traffic, both for its residents and also for emergency vehicles, because of rapidly intensifying storms that can come down very quickly. When these storms intensify, we can often see areas, especially in the Adirondack Parkway, which is very densely covered in forest, where there's a large amount of downed trees and can adversely affect our power and phone grids. And lastly, because New York State has numerous rivers and streams, the effects of rapid freeze and thaw can bring large ice jams and flooding events, where there is a need to have swift water rescues and river edge evacuations in very quick order. Next slide, please. Next slide, please. Casey, I don't know if I lost you. Can you advance the slide, please? Oh, sounds like we may be having technical issues.
I am. Apologies. 1 second here.
I am. Just 1 second. Sure.
Okay. Okay.
Okay. Could we go back 1 slide, please? Great. So New York State and NYSOFA is committed to health across all policies, an approach that incorporates health considerations in all of its policies and programs, even by non-health agencies. As an age-friendly state, NYSOFA considers how its policies and programs are always supporting this designation. And NYSOFA has made it a priority to embed emergency management within its statewide goals to ensure that the network of aging professionals are prepared to plan for, respond to, and recover from any array of emergencies and disasters. Go ahead. Next slide, please. There. So on this slide, there we go. So some interesting facts about NYSOFA and its designation as the state unit on aging. Unlike many of the state units, we oversee a network of 59 distinct area agencies on aging. NYSOFA does not provide direct services to older adults. We do not own or manage any other locations where any of the state activities are carried out or services to older adults. And each of our 59 agencies on aging are operated locally by either a sponsoring county, a non-for-profit agency, or one of our Native American tribes. NYSOFA is a member of the New York State Disaster Planning Council, and we sit in a emergency support function where we focus almost exclusively on mass care during emergencies. And that can range anything from sheltering activities, wraparound services, anything that makes individuals, especially older adults, comfortable if they're being displaced. NYSOFA's disaster responsibilities are accomplished by a group of state employees at NYSOFA that have various titles and additional responsibilities that they're responsible for. And when we deploy for disasters, whether it is at a site or at the Emergency Operations Center, it is often done in a collaborative stance where we are doing other activities. We put our other work activities on the side to focus on emergency response. If you can go ahead to the next slide, please. So when we think about older adults specifically in disaster planning, one of the key elements that we take away is that it is such a diverse group. There are no two older adults that are exactly the same in their strengths or their needs. And we wouldn't look at age alone to be the key for their vulnerability. Older adults that live in their community, often with just some minor assistance or check-ins from for their activities of daily living. The majority of that care is through informal caregivers, people that are not paid or on a schedule to do particular services for them, usually including family, friends, or neighbors. And as you can imagine, when a disaster strikes or there is a weather emergency, oftentimes those supports are pulled in other directions and they're not able to respond to the older adult that they provide that informal care toward. Additionally, those older adults that relied on those informal supports may now be at an increased need for a more formalized approach to their support and ability to stay in their homes. Next page. So in here, there's a number of issues, considerations that we take into effect when we're looking at disaster planning. We look at the increased likelihood that some older adults have limited resources. They may encounter food insecurity. So as we mentioned earlier, if there are home delivered meals they rely on and those are canceled for a period of time, not having that backup of food can be life-threatening. They may be resistant to seek and receive aid. Often there is a mistrust of government or strangers. We have all championed our older adults to be very cautious when giving out their information. And that is often a barrier to receiving and accepting assistance during a disaster. Many of our older adults are reliant on home-based services to meet their essential needs. And if those are disrupted, that can be very dangerous or a challenge for them. They're often very reluctant to leave their home or their belongings, and especially their pets. There has been a lot of progress made with our partnership with Red Cross and some sheltering so that we now have a much broader willingness to accept pets as the means to get our older adults to a safer environment. Some of our older adults are actually the caregiver to adult children or grandchildren or other friends and neighbors, and they can be torn in what they can do responsibly when there is an emergency that's presenting itself. Many of them require accessible or assisted transportation, which can be a barrier to leaving quickly and making sure that we work with our local partners to assemble a menu of services to help them in the event of emergency, whether it's accessible for them to be able to use on their own, or whether there is actually the need of another person to assist them in that transportation. As I mentioned earlier, that resistance to receive aid can often be stem from being targets for fraud or abuse and being more skeptical about mass information and directions to leave their home because the thought they'd be leaving their home unattended. There's also the concern about digital information and it being pushed out through some of our newer platforms that some of our older adults may not be as nimble when it comes to using some of the smartphones or tablets that we have at our disposal. And lastly, we can be looking at things about the need to relocate to a shelter, not being able to relocate or being able to accommodate for staying in their home. First choice may be to leave, but if that is not feasible for a particular situation, how do we best help older adults stay in that home safely? And you can go to the next slide, please. Additionally, many older adults have chronic conditions. They can have mobility issues, physical disabilities, cognitive and/or functional limitations. So what is the effect that they may feel if they go without some of those services? If they have missed medications, if they have no access to their oxygen because power is out, if they've missed dialysis appointments? How do we help those older adults to navigate in an unfamiliar setting, such as an evacuation shelter or changes in their schedules? There's also a higher risk of additional injuries during an emergency event. We've had instances where high-rise apartment buildings had to be evacuated very quickly, and older adults were often taken downstairs instead of elevators on stretchers or in the arms of fire emergency workers. There's a higher risk of injury that can come just from the actual evacuation. Additionally, a lot of our older adults experience some sensory and physiological changes. They can have lower vision access. They could have some hearing loss. How is that accommodated for when you're trying to do some of your disaster planning and response activities? We may need to access low or high tech assisted devices in aiding in that messaging. Next page. So NYSOFA, as I mentioned earlier, is unique in that it works with 59 area agencies on aging. And of those 59, we look at a network of over 1,200 subcontractors that work at the community community-based level in providing those direct supports to older adults. It is that community-based network that allows NYSOFA to be a conduit of information, both that we're pushing out in form of prevention, for training, but also receiving information in. Those are our eyes and ears on the ground level that can tell us when they're encountering things like road closures or massive power outages or any of the things that can happen where we would like to get that information to the higher level of either an emergency operations center or any of our community partners. Next page, please. So in this slide, we really wanted to summarize that NYSOFA embeds emergency management in a number of ways. And so just on a regular blue sky day, we're always maintaining situational awareness. This is done through daily briefings that we receive from the State Emergency Operations Center, where they may be telling us about maintenance to some of our nuclear power plants. They may be telling us about potential weather patterns that are coming. They may highlight to us by county where there are some power outages that may have occurred. And we'll look through those every day and we'll decide whether or not that something on there rises to another level where we would like a little bit more information from that, that county or that organization. Another way that we embed emergency management is through our 2 annual plannings. We do plans that go looking forward in what they propose to do. And then we do program reviews that look back at what they've actually done in the past. And we evaluate the effectiveness of their programs. And emergency management is one piece of that puzzle. So in our, and I think I'll go into a little bit more detail about that, but the annual plans allow the AAA's, Area Agents on Aging, to describe to us all of their collaborative partnerships at their county levels, making sure that they don't duplicate services, make sure that they identify when they're going to be doing some drills, if they have some training opportunities, all the things that go into, in a perfect world, this is what we plan to do. The program reviews, we look back and we say, okay, how effective were some of your trainings? Tell us about it. How did you meet together with some of your community partners? Have you participated in any of your local EOC drills? And we'll ask them to describe what it is that they've done and if there's anything that they would like to change going forward. Another way that we do that is we participate, oh, yep, we're still here, thank you. We participate in localized emergency management drills. And so what that entails is we will work together with our local AAAs and with our state emergency operations center, and we will do some tabletop exercises. We will always do some of the seasonal ones just to brush up on how we handle large snowstorms, how we handle ice events. We also have changed courses, and we've done a lot of work on extreme heat, knowing that that's the flip side of this cone, is we're seeing a lot of very high temperatures for longer periods of time. And once again, older adults are extremely vulnerable in those situations. So although the interventions may be similar, and I'll go into some of those on the next slide, we can quickly change between the situation that's presenting itself to us. And this goes for man-made disasters also. Oftentimes, it's not necessarily what triggered the event, but it's how we are going to handle helping our older adults to overcome any of the barriers that come out of it. And then the last 2 are really about our extreme weather communication. We do a series of reach outs to our AAAs, and I'll go through those in more detail on the next slide if you'd like to advance. Okay. You know, just to hit on this quickly, I think I covered it on the last one. One thing that was I wanted to draw attention to is that some of our AAAs have very unique considerations and circumstances. So it makes sense that for them, each one of the 59, they have very specific plans on how they would mitigate those hazards. And so we have some that are in close proximity to nuclear reactors. They have a lot of drills and tabletops that are around that topic and how that affects older adults in their areas. We have obviously wide bands of lake effect snow zones, everything from Erie County all the way up to the Canadian border. And those are very specific drills that we do in those areas for them. When we go downstate into our New York City and Long Island regions, we worry about coastal flooding. And a lot of our Hospitals and nursing homes are very close in proximity to those areas that can evacuate. And so having those dialogues and those drills that are specific to those areas help us to know that we are more prepared when these events could happen. Of course, no scenario can be 100% prevented or mitigated. Next slide. So one of the largest things we do on a regular basis, as I mentioned, from a ready state to some sort of event that is coming, is we follow kind of a 4-step approach, and we will have a conversation internally with our team, and we'll look at the daily updates that are coming from emergency management. And we may say there is something coming up. There's a storm coming. There are whatever things that we can actually foresee. Some things are not able to be foreseen. And what we'll do is decide, is this something that we want to proactively reach out across the entire state? We think it will have an impact across all borders. Or are we going to take a targeted approach geographically? Like, are we going to look in that snow band? Are we going to look in those coastal regions? Is this something that will affect our New York City partners uniquely? And we will work with them to ask them 4 very specific questions up front. And it will range from a pre-planning to a middle of the event to a post-planning. And so we'll ask them about whether or not they have done any preventative measures. Have they pushed out any information? Have they made some phone calls to their more vulnerable clients? We will ask if there plan to be any disruptions in services. If there are, such as home delivered meals, we'll ask them if they're doing anything proactively to mitigate that. Will they be sending out things that we call blizzard bags or shelf-stable meals in anticipation that they will likely have an interruption in that service? We will ask them if their local EOC is open, and we'll ask them to describe to us that if it is open, what will your role be? Are you actually going to bring staff to EOC so that they can participate on behalf of older adults? Or are we looking at something where they are maybe just reporting up any information that they find that are specific to older adults? And then lastly, we will ask them to report out to us anything that is a triggering event they may find along the way. So they've planned for, things have happened, but now we have a specific scenario. There is a tree down on this major highway. This is the impact it's having. So we get that information, we process it internally, and we have key partners that we share any of the important pieces with, such as the Governor's Chamber, our executive leadership team, and obviously the State Emergency Operations Center. If they have already heard it, that's wonderful. We're just reinforcing it, but oftentimes we're hearing something at a local level that is very vital for our state partners to hear for the first time. So as we go through, and I think you can kind of go through to the next slide. The idea that the communication stops once that weather front ends isn't necessarily our experience. We will continue to support our AAAs and the older adults that they serve throughout the event and then after, to make sure that where there has been service interruptions, that we are making sure that we've checked back in with older adults, often with individual phone calls, making sure that they, what we thought preemptively was okay and held, or whether or not the duration of a storm or an event has now kind of taken away that opportunity. What was good for 2 or 3 days, now that we're 3 and 4 days out, there may be some fatigue there. We also ask about any areas where older adults may have been displaced or required to evacuate, making sure that the AAA has enough supplies and resources to help support them, possibly be providing wraparound services for them while they're out of their element and trying to minimize the trauma that they may be experiencing. We also will talk about power outages for any long length of time, and whether or not the AAAs have continuously checked in with older adults, especially the most vulnerable ones that we know are relying on it for oxygen, for refrigeration of medications, for the power source to their hospital beds or any of their other adaptive devices. Making sure that, again, that time frame, right? They may have said, I'm good, I have a backup for a day or two. But as these events go on, making sure that we get them out of the event and back into a comfortable situation. And lastly, one of the concerns we have had over the last couple of years, especially with extreme winter, and also with some of our heavy rain events that we've had, is whether or not people who have been evacuated from areas have a safe environment to return home to. Oftentimes that's outside of the Office for Aging's parameter, but we'd be looking for them to collaborate with some of their other community partners, possibly their housing departments, possibly local FEMA representatives, to make sure that the roofs are still in good shape. We don't want there to be secondary injury from a first event. And so we will continue to work with our AAAs and make sure that they have been able to address the issues that their older adults have encountered through an event. And then obviously there's no need for a slide in there, but the debrief process. After everything is said and done, after we feel that we have returned back to a steady state, we'll often reach out and say, what worked? What didn't work? What did we miss? And that helps us to formulate what we want to do for future trainings, for future communications, even future policies and procedures, and making sure that we're able to meet the older adults where they are when events happen like this. And I think that's all I have. Thank you.
Thank you so much. And I would like to turn it over to Dr. Donald Reed.
Okay, hello, I'm Dr. Donald Reed from McDowell County, West Virginia. I am the director of a county level aging program. So a little bit of a different perspective than your other presenters, kind of really at the local level. So as you know, but just so you kind of follow the process, we have our state unit on aging, which is the West Virginia Bureau of Senior Services. We have our AAA, or the Appalachian Area Agency on Aging, and I'm the county provider in McDowell County. Oops, I missed a slide. I missed this slide. I wanted to just give you a little perspective of kind of where we were at when we talk about McDowell County. We're a small county of a population of just under 19,000. We have a high poverty rate. I think we're actually the 7th poorest county in the nation. We have a 19.4 minority population, 6% veteran status, 32% of the population is age 60 plus. The median household income is low. Again, very rural community. Many of our seniors are very much isolated. Their children are gone because they've left the community to get jobs. So often the Commission on Aging or the Senior Network is really a vital support network for them. So the state unit on aging, or the Bureau for Senior Services, in their policy manual requires that we have emergency contingency service operation plans, or we call them ESOPs. And these are written annually, written annually, and then submitted to the AAAs, and then approved or revised. And these plans must address kind of like natural events, which would include extreme weather, pandemics, and then man-made events, kind of that emergency preparedness concept. These plans must include emergency closure of operations, describing what conditions or reasons would close the agency, including extreme weather, guidelines of who has the authority to close that agency, and the implementation of the contingency services, guidelines of how we would notify the staff, seniors or service recipients, and the general public, identifying and having emergency plans in place for high risk or very vulnerable seniors or those with disabilities, plans for coordination with our federal, local, and state emergency response agencies, and then a contingency plan of how we would continue or modify services during those emergencies. Again, these plans are submitted and reviewed annually by the AAA, And, you know, the lessons we learned from one year, we incorporate into next year's plan with the concept of continuous improvement. So that's kind of the concept. What actually happens in reality, or how do you take the concept or the plan and how do you implement that on a local level? So I've kind of broken down some just practical steps that we do as we are preparing to kind of enter our extreme weather season, which is mainly, the snow in the mountains. Our average snowfall here is 68 inches. Our winter can often be in single digits. Our real challenge is really helping those with limited mobility, limited resources, and limited support mitigate the hazards of extreme weather. And forgive me, I did forget my introduction because I was nervous. But for those so to give that, I'm a Caucasian male. I have brown but graying hair. I'm clean shaven except for my 5 o'clock shadow at 3 o'clock. I'm wearing a blue vest with a long sleeve shirt, and behind me is my blue office cabinet. But going back to the presentation, the practical steps or the practical application. In October, we give all seniors or all clients the emergency list from FEMA, and then our in-home staff or our Meals on Wheels staff go over that list with the seniors. Seniors preemptively get 5 emergency meals, and we distribute those in October in preparation for extreme weather. Because of our level of poverty, we do work with a faith-based group, and seniors are provided with blankets, kind of like homemade blankets often, in September and October. We kind of ongoing, but especially throughout the winter, we check with seniors about their heating sources. We still have a lot of people who heat with wood and coal. And we partner with the local DHHR office to promote the Low-Income Energy Assistance Program for utility assistance during the winter months. Seniors are regularly referred to local winterization programs. Mill drivers and in-home staff assist with smoke alarms, especially if we're burning coal and wood. Seniors are entered into our mass messaging system for robocalls and text. And this is kind of ongoing because it's a great way to remind seniors to be prepared for oncoming winter weather or extreme weather. We have a vulnerable list of seniors that's distributed among staff as it's updated. And our in-home workers, we have winter weather predicted in the next few days. Our in-home workers prepare our seniors and those with disabilities as we have been notified to get prepared. The office registers with local media. We have a messaging system through the television, and we register that annually. We have our quarterly phone calls with our health department and our local or our county-based Office of Emergency Services. So before or actually during an emergency, we kind of go into that local coordination. All office staff, maybe that's a better way to say this, all office staff are given responsibility of which seniors or those with disabilities that they call during an emergency closure for wellness checks. And then we also have emergency contacts that are often relatives, but we also have their neighbors' phone numbers in case we're able to contact the client. We notify our media outlets and AAA and the state office of any emergency closures and our current capacity status. Seniors are used to using local television outlets and our robocall system, but we're also starting our own low power FM radio station. And we have our neighbors and community members check on their neighbors to provide them a meal, to make sure they're warm and safe. We take that vulnerable senior list, which specifically focuses on those who need oxygen and other life-saving medications, those who are bedbound, and those are given to the local Office of Emergency Services. And then as the executive director or my designee, we coordinate with the Office of Emergency Services and the County Commission to provide emergency food provisions or even meal preparation for any seniors within our county, even if they're quote unquote not our current client. But in the time of emergency, as a community, you really have to come together and meet whatever the need is. We provide emergency transportation, or I should say transportation, as long as it's safe for our vehicles and drivers to be on the road. We do provide access to our state-owned hospital as long as it's not an emergency. Our centers are not designated warming stations or emergency shelters, but we have installed showers and are in the process of installing washers and dryers in most buildings for staff and clients. And during the winter, we're often open for extended hours because we found that seniors often actually stay longer at the senior centers during the winter because they're trying to save on their heat bill, or they're limited with their resources, and they're looking for a warm place to be. After the winter weather situation, we always debrief on the individual senior or client, as well as staff. We review our process and procedures and kind of adjust as needed. And that's our viewpoint from kind of a county aging provider.
Okay. Let's turn over to look at some of the questions. Thank you to all of our panelists. Just a really quick note, and so that we don't miss this. I want to thank first ACL leadership and our panelists for being here to discuss these best practices in preparing for extreme winter weather. And just letting everyone know, I've seen the question a few times. A brief reminder, this session was recorded and will be shared in the coming weeks, along with all of our other extreme weather related webinars. So they will be available on acl.gov. So let's see. Mary Lou Seolfi asked the question, are any of the presenters working directly with formal or informal groups of older adults in the community to update response plans and or to debrief how well or poorly a plan worked after the weather event? If so, can you offer details of how these meetings are structured and used for improvement?
Hi, Casey. This is Tina from New York State Office for Aging. Just because of the structure that we have as the state unit on aging, it's often, we rely heavily on the local level. And so feeding that information up, we would have our area agencies on aging who work directly with and contract with those providers to provide that level of debrief to them. And then we would talk to them as a group about what went right, what didn't, what we'd like to change in the future.
Before I move on to another question, do any other panelists have a response to the question?
Hi, this is Daryl Schaefer from Alaska. I would say that very similar to what Tina just mentioned, I am involved in several statewide level offices, And because Alaska is so diverse and so spread out, some of the local agencies, we rely so heavily on them because they have such a massive area they have to be responsible for. So we tend to just look for whatever local resources are being used, see how they're dealing with it, and see if there's anything we from the state would have to address or implement or change in our policies. Thank you.
Anyone else before I move on to the next question? Okay, so Stephanie Coleman asked, for those who use volunteers, what are your policies when providing client information? Asking as someone who works at local government.
Hi, this is Joy from Aroostook County, Maine. I would answer the question that our volunteers, they go through rigorous training that includes review of confidentiality policies, as well as sign off on a confidentiality form. And they are bound by the same level of confidentiality as a regular staff member. So that's how we handle it. I mean, they receive a volunteer handbook, just like the employees do, that outlines all of the requirements related to that.
Any other panelists?
This is Donald Reed from West Virginia. Our process is almost exactly the same, very similar. The volunteers have almost the same requirements as employees.
Another great question from Stephanie Coleman. So what are the transportation resources for those that need assistance during winter weather when the need is not high enough to escalate to law enforcement or AMR?
Well, I can take a shot at that. I think, of course, this varies greatly by community. But we work closely at the Agency on Aging in Aroostook with our local transportation system. It's called the Aroostook Regional Transportation System. We really don't have, I mean, transportation is an ongoing challenge. We don't have strong taxi services or Uber or anything like that in our community. So we do have a regional transportation system with limited runs to the most rural communities, as well as they do have some volunteer drivers associated with that program. So we certainly reach out to them. We do have a few communities that have volunteer driver networks, so we'll reach out to them. We also, through our community resource specialists, reach out to different people in the specific community the person resides, such as a church community. Sometimes we reach out to town managers and say, we're trying to help this person, or we don't often say the person's name, but we have a consumer in your town. What do you have for ideas or resources in that town? Thanks.
Any other panelists? Okay, I have a question. So I'm curious if you could share some of your best practices in ways in which infrastructure improvements such as snow removal or power restoration can be prioritized to address the needs of older adults and individuals with disabilities first.
One thing, this is Joy again from Aroostook, I'd mention is that I think that's already happening to some extent in some regions of the country. As an example, my mother-in-law was homebound with oxygen, And I know that the power company had this in her file so that they could respond to that. In addition, we have, actually in our region, we have very, very good infrastructure to support extreme winter weather. So oftentimes we don't run into these situations, I think, because the infrastructure is there related to plowing or other things. But we also at the Agency on Aging help people to link to resources. So in that case, if we have someone that is on oxygen, perhaps we can find ways to link them to resources to get a generator so that they aren't solely dependent on the power company. But like I say, the power company does, I think, have this on file and is looking out the best they can as well. So there's a partnership there.
And this is Daryl from Alaska. I would agree with Joy. We have some of our locations that have the same intent, same idea of the local power company may have the list, or the emergency management may have the prioritization of critical infrastructure, the hospitals, the water treatment plants, things of that nature. However, I'm going to turn it on the other side that we have some extremely geographically isolated locations that, as a matter of fact, we just heard a day later that a place lost power. Now, that was 2 days ago, and we just heard about it yesterday because there is no infrastructure. There is no connection to the outside world from that location. Maybe a satellite phone. That's really challenging. And this is where it comes into, there is some resilience. There's a lot of indigenous villages that do have the history on how they deal with stuff. But at the same time, we've started to put more Western culture into this. So you need to have a water treatment plant. You need to have a power plant. Well, the power plant is next to the school. It burnt up. And there is no power to the water treatment plant, and nobody's around to fix it. Thus, nobody's available to go get something. This is one of the big challenges that we're dealing with in Alaska right now, at the state level and at the local level. Thank you.
Great, thank you. Anyone else on the panel? Then I have one more question, and it is, oh, this is really great. So Texas, Andrea Earl said, Texas is not doing that. Priority restoration, referring to priority restoration. How did power companies get on board? And from what Joy said, it sounds like that might have been already in place. But if any of you have experience with it, a little bit more experience in maybe creating those kinds of relationships and that engagement, I'm very open to hear from you.
Hi, Casey. This is Tina again. So with the New York State emergency management hierarchy, we actually have state energy and its partners, everybody that it oversees. They have a voice in all of our emergency preparation activities and drills so that we can play out some of those scenarios, look for where there's system vulnerabilities, and then see how it might uniquely impact different groups of people at different times. It's also really important when it comes to staging before we have large events. So if we know that a storm front is coming through, that agency head will take the reins and make sure that those resources are staged in an area where they can quickly respond as soon as the hazard has gone away.
Great. Okay, anyone else? All right, and I'm going to wrap it. Oh, go ahead, Dara.
I think there's one point to mention about Texas. It's a little unusual from the rest of the country because Texas has a privatized electrical system versus the rest of the country, for the most part, has integrated into the grids. That becomes a challenge. So if Texas wants to address it, it's almost like, how do you address your shareholders? To put it bluntly from an emergency management view, how many body bags do you want us to bring in? No, you don't want to say that. And you don't want that on the front page of whatever newspaper. But that's kind of the approach you need to address is how many people are you willing to not survive in order to get this thing through?
And that brings us, I appreciate you all. Thank you so much. That brings us to the end of our webinar today. For the questions that were not addressed, we are going to take those and add them to the list of questions that we've been collecting through the year with all of our climate and extreme weather related webinars that we have held with FEMA ODIC. So keep an eye out for those. We're going to be posting all of those webinars and the questions on acl.gov with resources. Oh, yes, Yelena, you have a question. Okay, that might have been by mistake. Well, I just want to once again thank all of the panelists and all of the people who were able to attend today's webinar. And I hope you all have a great rest of your week.